Afternoon, everybody. We're now at a critical time here in Ohio in regard to the coronavirus. The decisions that we make as individuals in the next few days, the next several weeks, will really determine how many lives are going to be lost in Ohio. It will also determine how long this is going to last. We have learned from past pandemics, and we have also learned from what has occurred in China and Italy and other countries. Those have been very instructive, as well as what's happened in other U.S. cities. All of this really helps to inform us. Every act each one of us takes now has very significant consequences. Each decision will not only impact us, will not only impact our families, but will impact people we don't even know. And that is one of the messages we have today. We are at a critical time, and we need to get this right. Every action each of us takes can and will help save lives. Lives of our children, our families, our communities. And as I said, lives of people we don't even know. People need today to take the steps that they can to proactively and voluntarily help slow the spread of this virus. This can range from good hand washing, using hand sanitizers, to staying home, staying away from others when you're sick. Don't put yourself in a position where you're with someone else who is sick. This morning, I called upon people that we have put together who are medical experts who understand what is going on. And I've referenced them before, and I want to thank them again for being there for us, and we intend to continue to talk with them every single day. These are physicians, these are healthcare professionals across the state, and our goal was to get the best advice on how we move ahead in Ohio. They have told me that in order to slow the spread of the coronavirus, we need to make the tough decisions now, that the decisions we make now will have a huge impact. I'm talking now particularly about the gathering of a large number of people together. The doctors have told me that the more we can do to limit the spread, the better position we will be in to slow that spread and, frankly, to get through this in a faster period of time. This is certainly not going to be easy. The chart, Dr. Acton will refer to the chart in a moment, but the health experts have explained to me our goal is to take action here that cuts this down, maybe even as low as here. Again, this is based on what experts have told us. This is based on what we have learned from past pandemics. This is also based upon what we have learned in regard to the coronavirus. And Dr. Acton will, as Director of our Health, will explain that. One of the things our experts have talked to me about is social distancing. Again, responsibility that each person has to try to stay away from crowded spaces. If If anyone is in your household who is sick, you should act as if you are sick. And again, avoid other people. They've also told me that this virus is twice as easy to catch, to pass on, the flu. And we know the flu is very contagious. Each person, each Ohioan needs to evaluate the risk that they take by every action that they take. I've also had a series of phone calls and personal meetings today with a number of different groups, and I want to share with you the advice that we have given them based upon, again, what the doctors are advising me. I think it is important for us to be consistent, to be open with the public, and so I'm going to share exactly what advice that I have given them based upon not my expertise, but the expertise of doctors and people who have studied this. We had discussions today, I personally had discussions today with our 2-year college presidents, our 4-year college presidents in the public arena, as well as a conference call with our private colleges. The recommendations for these schools are as follows. Each one is in a different position in regard to spring break, kids coming back, students coming back to campus. Timing is different. But as these students come back, the strong recommendation is that each one of them be screened, particularly if the ones who are coming back, let me rephrase that, the ones who are coming back from a foreign country should be screened by that clinic, campus clinic, doctors, nurses, health professionals there. This would also include any student who is coming off a cruise ship. The questions that have been posted in the CDC for some time are the questions that these students should be asked. Where were they? They should be asked who they were around, and all the questions that are there. Second recommendation, and many of our schools have already followed this, is that they should eliminate any international travel for the students or faculty. Third is just the basic principle, again, of minimizing the gathering of groups together. And the fourth is, the recommendation is that colleges and universities in Ohio go to remote learning, do not have any classes where there's students there and professors there. Again, this is the guidance from the experts. The goal is to avoid the gathering of large numbers of people. Let me move on to sports. I had the opportunity to talk to Jerry Snodgrass, the Ohio High School Athletic Association, and I also just got off the phone with, I believe, most, if not all, of the professional sports teams, representatives from them in the state of Ohio. Again, the great concern is indoor events where there are spectators. And so the recommendation is that for indoor events where there are spectators, that there be no spectators. And that the event can continue on with the athletes and with those people who are essential for that competition to take place. This is the advice that was given to the High School Athletic Association, to the colleges, and to the professional teams. At this point, the recommendation is, in regard to outdoor sporting events, that those could continue. The planning for those could continue, but the understanding is that this is changing by the day and could change in the future. It was also recommended with the high school students, for example, as we did with the Arnold, that the parents could be there. And let me just say, as someone who loves sports and as someone who has had not only children but grandchildren in high school sports and college sports, that this is, I understand how difficult this is. And it's not something that anyone enjoys talking about, and I certainly don't enjoy saying, nor envisioning sports events without spectators. Let me talk about other gatherings. Sporting events today, even those that are outdoor, such as Major League Baseball. We have opening day coming up. And one of the things that we have seen is large gatherings of people in alleys or in streets. We believe, the experts believe, that this is a real problem, and that is a recipe for disaster. Again, this is something that we are seeing more and more of in sports. It's a lot of fun. People really enjoy that. But again, that is a gathering of people in a close area. That is, even if it's outside, experts believe that this should not take place. The same would be true with parades. Parades cause gatherings of people. Again, those gatherings of people pose dangers and significant dangers to the community. We would ask our churches, our synagogues, and our mosques, and some have already. I know from last Sunday at Mass, changes were made, at least in the church where I was, in regard to shaking of hands and in regard to giving wine at communion. So I know these changes are already taking place. Certainly don't want to infringe on anyone's religion. Just the recommendations would be that people, again, be cautious and be careful and try to eliminate the practices that could potentially cause problems. As many of the churches have advised their parishioners, it's okay if you are in a at-risk group, probably okay to stay home on Saturday or Sunday. Again, these are individual choices that are going to have to be made, but there's a great concern from the experts in regard to that. I think this is also an opportunity for our churches, our synagogues, our mosques, our congregations, our faith-based community to do what they do best, and that is to help people. We will see people who are going to be in the future confined to their home. We're going to see people who aren't going to be able to leave their home, and leaving food at their doorstep, or leaving food and helping them in ways such as that is something that is going to become more and more very important. Our nursing homes. We know that our nursing homes house probably our most vulnerable Ohio residents. That's because of age. It could also be because of frail health. We ask the nursing homes to be very, very careful in screening visitors. One of the things that people like to do, and one of the charitable things that people do, is to go see other people in nursing homes. We would ask people to, I wouldn't say not do that, but again, be very, very careful that you're not taking a problem into that nursing home. People who feel sick, people who are in a family with someone who is sick certainly should not go into the nursing home, and we certainly would ask the nursing homes to step up their screening of who goes in to the nursing home, not only as visitors, but as vendors and anyone else who is going into that nursing home. We obviously know that certain things are going to have to continue to happen, but again, being careful with that. In that same vein, we have stopped visiting in Ohio prisons. We have stopped visitings in Department of Youth Services. We understand that that is difficult for families. We have actually expanded visiting in some of our prisons under our new director. We again hope this is temporary. We know it will be temporary. We hope it's a short period of time. And we're sorry for that. But again, this is an action that we needed to take. We're asking that entrance to the prisons be restricted even further. No contractors except those who are actually critical to the mission. Nobody else unless they're absolutely critical to the mission. For those people who are permitted in, their temperature will be taken and other steps appropriate will be taken. In regard to our jails, I know they are moving forward, and the Buckeye Sheriff's Association is sending out guidance. We also know that guidance is in conjunction with recommendations from the Department of Health. Let me talk briefly about K through 12. The recommendation today is not to close K through 12. But I think people should be thinking, parents, principals, superintendents, teachers, about what would happen if these schools had to be closed. We are not there at this point. We don't know whether we will be there, but parents need to prepare for the possibility, as well as teachers for the possibility of that occurring. As we said yesterday, the coronavirus is changing the way we are operating and will cause great inconvenience. We need to take as many precautions as we can to keep it from spreading. One person can potentially impact many, many people. Let me now ask Dr. Acton to make some comments, and then we'll be happy to respond to some questions.
Thank you, Governor. Good afternoon, everyone. As we have said all along, the situation will continue to evolve, and I'm going to take a few moments to explain to you the science behind what you're seeing is happening. But first of all, I do want to share with you that we do at this point still have 3 confirmed cases in Ohio. We have 15 persons under investigation. We have 14 people who have tested negative. Again, as I've said, we're going to see these cases go up. We have many tests queuing up in our labs as I speak. And we should expect to see more, and we should expect to see what we really suspect is that we do have community spread. We'll be detecting it as the days go on. I want to tell you about our call center, which I think has been so important because as with each of these conferences, we know people are increasingly more afraid, and so we want people, again, reaching out. Our number, again, 1-833-4-ASK-ODH. On Monday, we had 1,051 calls. Today, we had 300 in 3 hours, so we're about 100 calls an hour, and we are fully staffed and fully ready to take folks' questions. Also, our website, so important. We keep saying, again, good sources of information, coronavirus.ohio.gov. We've had over 65,000 unique website visits. Some of the most popular parts of that website are how to prepare, household checklists, spring break guidance, and frequently asked questions. So these are the sort of things that your viewers and the folks here at home are thinking about. And, you know, I know being married to a teacher, each and every one of us is asking a lot of questions, and I'm hearing a lot from folks on the front line. Our governor is leaning in. We know from what we see around the world, from what we understand about pandemics, from all the things we do to prepare for this, and we do stand prepared, that this is a natural evolution of what we should be expecting, and we're seeing it unfold in cities all across this country. My colleagues in other cities are saying to me, places like my colleague in Washington State, for example, take action now. I only wish I had the time that you have to get a few more things prepared. And so you will see our governor taking this very seriously, because there are things we can do now that absolutely make a difference. So let me show you why. Thank you. Sorry, this is new for me. So this is classic epidemiology and classic talk about a pandemic. And again, I keep saying it's predictably unpredictable. There are stages that the spread of a virus takes, and you can predict those. And all of our measures, I know it's confusing. We say one thing one day, the next thing the next day, but we're actually progressing along a continuum of increasing measures to protect the public. So when you have a pandemic, think of China and what happened in Wuhan. That is our yellow. That was the fate of China. It was a very quick, rapid spread. Everything that the United States has been doing has been to slow it down. They've always known all along it would spread, but every measure taken, starting with the unprecedented measure since 1969 of closing of borders, was meant to slow it down so all of us would have more time to get ready and get more measures in place. And so what that shows is, in the United States, everything we are doing is to turn yellow into blue. To slow down the onset, to decrease, most importantly, decrease the number of people affected, and ride it out. There is no scenario where there isn't a curve. It's how small can we make this curve, and that means how many lives can we save? How many people can we prevent from being ill? How much can we prevent an undue burden on our healthcare system? So every step we're taking now makes a difference. One of the fundamental principles in public health, and this is hard, again, I know it's hard for people to get their head around this. As much as we tell you what to do of your personal responsibility, only a third of the things that impact your health are in your individual sole control. I can tell you to eat better, to diet and exercise. There are things you can control. And why public health so long neglected, so important to know that 2/3 of the things that impact our health have to be solved at a population level. They have to be solved collectively. We live, as I've said before, 30 years longer than we did the last century. I've told you that only 5 of those are the very high, expensive, high-tech things that I learned in medical school. 25 of those years came from these public health measures, these population health measures, prevention of infection, the things like safe food, clean water. So the actions I take as an individual right now, as a healthy, sort of, less healthy every day here, 54-year-old woman, you know, I am definitely at an increased risk for this. We know that 40 to 50-year-olds who contract this right now with the data out of China, 1 in 250 could die from it if they actually have the disease. So even I am at a greater risk. But the biggest thing is the choices I make for me and my family, it might not affect us, but it's going to affect your grandmother. My not getting sick is going to keep 2 to 3 other people from getting sick, and that is logarithmic. Each of those people can infect 2 to 3 more, and that's what you're seeing in Italy now. 2 weeks ago, 9 cases. Today in Italy, what you're seeing. So it is that logarithmic spread of us to each other, even those amongst us who are healthy, that will make all the difference for those of us who are most at risk. And that everything we do in those stages is there. Each day, each hour, you are seeing more and more measures being taken. We know that Ohio State made some hard decisions to go to online. We saw Harvard make the decision to send their students home. We're going to see more and more of these decisions in the days to come. It's hard for people to tolerate ambiguity. On our website, we have all sorts of tips, and those tips are being updated. Just today, we put some very fast, 5 fast things you can do in every sector. We see businesses like Scott's here in Columbus taking new measures voluntarily with their workforce. The overall gist is if you can make a decision, if you can exercise the decision to stay at home and work from home, if you are a non-essential employee, now's the time you'll see those businesses making those moves. Because there are a certain amount of us who can't make that move, that need to show up at work, our nurses, for example. So the more of our society that makes some of those choices now, the more it will protect the rest of us who have to keep doing it. Same as that, individual families, what is good for one family, maybe somebody who's taking a caregiver to the mother, is different than the next family. So each of us now has to use our common sense, kind of think about our own risk, and make those decisions. It might be something as simple as going through the drive-thru and not going in a restaurant. But there are little things and big things that all of us will be doing in the days ahead to slow that down and really decrease the amount of impact it's going to have. And I know you're going to have a lot of questions. I can't answer every single question of the one-off situation. It really is taking the general principles that we'll keep giving you day by day and applying those to your life. I think I'll stop there, and I'll wait for your questions. We have, I don't know,
Somebody, you want to say?
Hi, I want to go ahead and address if we're prepared. So we have, oh, I'm sorry about that. My name is Sima Merrick, and I'm the State Emergency Management Director. You would think this was my first time doing this, but it's not. So I wanted to address a little bit about the State Emergency Operations Center. We have activated that Operations Center with 3 of the support functions. What that means is the staff from those areas, health and medical, infectious disease, planning and assessment, and also from our public information, are activated to work together in the center to discuss what's coming in, how we best address it. The most important thing to know is that we plan for this. We train, we get together, we exercise, and we have drills to do this. So for us to come together is really testing the test, right? It's testing the drills that we have put together in our partnerships and working closely. And Dr. Acton and I spend a lot of time working together in times of rest in preparing to address these types of issues. Thank you.
Okay, happy to take any questions.
The Blue Jackets, we have concerts here in Columbus. Your recommendation is to tell people do not attend any of those events.
The recommendation, unanimous recommendation of the doctors is that people not attend the event. It's also that the events not be held with spectators.
How receptive are these professional sports organizations to?
Well, you will have to ask them. We just got off a conference call. One of the things, the points that they made, the Cavs and the Blue Jackets made, was that they have a different ventilation system. And again, it moves air much quicker. That would be their argument. So now, in fairness to that was just a discussion that we just had. In fairness to them, discussion we just had. I've not taken that back to our panel of doctors. So, but, until further notice, our position is that these events should not occur.
These are recommendations, but not mandatory. Is that correct? Do you have the authority to make?
Well, we haven't got to that point. We've not got to that point, and so that's right. Today we're talking about, recommendations. And again, with only 3 confirmed cases in Ohio, people may say, well, Mike, why are you doing this? Aren't you, the answer is we've learned from what has happened in other countries, and we see how fast this moves. And we've learned from them, we've learned from other pandemics, that there's a point in time where you can't get in front of it. That's probably not the way to say it, because you know, you're not stopping it from coming in, but we're slowing down. Our goal is to dramatically slow down the spread, thus saving lives, and thus, at the same time, maybe getting us through this period. We don't know how long this period is going to be, but this period of danger. We are now in the period of danger. And we are in a period when the tough decisions that we're going to make, and look, these are horrible decisions in the sense that no one wants to make these decisions. But we don't want to look back and say, oh my God, you know, we could have saved a bunch of lives, but we didn't learn from history. We didn't learn from what happened in other countries. We have to learn from what's happened in other countries. We have to learn from what has happened in prior pandemics, and we have to listen. We have to listen to the experts and what the experts are saying. And what they're saying is, do not have large events. Do not be in a situation where we're throwing a whole bunch of people together. And again, people make the right choices, we will get through this. We're not saying we're not going to get through it and without people coming down with this. We know that's going to happen. We know people are probably in all likelihood going to lose some people. The goal is to reduce that dramatically. And now is the time to move, and now is the time to take action.
Governor, just to clarify, is your recommendation on sports, does that cover college as well?
Yeah.
Including March Madness events?
Yes. Look, the question is, would it cover March Madness? Look, you cannot make a distinction between, you know, showing up for a high school game, showing up for a college game, or showing up for a professional game. It's a gathering of people coming together, and a large number of people in an indoor arena. And that is what the experts have told us is we should not be doing this time. You can take the same principle as I talked about in getting, you know, opening day, where a whole bunch of people are outside, congregated closely together, drinking or whatever they're eating and having a great time, but they're together, and that's dangerous. You know, the experts, so far at least, are distinguishing that between an outdoor event, such as actually walking into the ballpark, sitting down, getting up in the third inning, getting your hot dog, and coming back. Is there a risk? Sure, there's a risk. There's a risk whatever we do, and there's a risk from that. But it's not at the high level as people being pushed in together. And the fact that people are inside heightens the risk, according to the experts. Again, the pushback that we got from the two professional teams, and we have not gone back to our experts, is, look, we have a much more sophisticated ventilation system, we move air quickly through, et cetera. I've not checked that out. We've not asked our experts. We fully intend to, and we intend to have our experts engaged with the two professional teams. That was how we left the discussion half an hour ago.
You haven't mentioned this, but what discussion has there been of suspending domestic flights in and out of Ohio, you know, close quarters, mobility, the same issues?
We've not had that discussion. Again, this would be primarily a federal decision. You know, look, I will tell you what I told my own family in an email last night. I said, don't fly.
Governor, so you haven't issued any orders to enforce these recommendations, correct?
No, that's correct.
So what kind of factors are you keeping track of leading up to the possibility of needing to issue a public health order in the future?
Look, I mean, what we would hope is that individuals would heed the advice of the experts. We would hope that people who are behind, or either organize the events or whose teams are represented, would take the appropriate action. Now, look, I fully understand. I expressed this to the professional teams. I said, look, I understand you're in leagues. You've got to consult. You've got to, you know, take action together. What I owe the public and what I owe every Ohioan is the truth as we can determine it. And the truth as we can determine it from the experts is this is dangerous. It's an unacceptable risk to put that many people together for a long period of time inside. The timing couldn't be worse. We're heading into March Madness. We're heading in Dayton in the 2 nights of play-in games. We're heading into Cleveland in the first round of NCAA basketball. Look, it could not be worse. But we can't hide this. We can't shove it under the rug. We can't ignore it. We can't wish it away. We've got to call it like it is, and that's the way it is.
Governor, have you had discussions with your administration at all in terms of how to handle like a National Guard situation like what's going on in New York today?
Our National Guard is prepared to do what they need to do. We have not reached the point today where having the National Guard do something like we're seeing in New York has occurred. The National Guard trains for many contingencies. Many of them are overseas. Some of them are here in Ohio. So we will be prepared to do that if that is the most appropriate way to do it.
Doctor, can you talk about the number of tests Ohio has now, and is a doctor's order good enough to get treated if someone suspects they have coronavirus? Can you talk about it?
Yeah. So absolutely, we've been talking about a three-pronged approach we're taking in this state. You need a doctor's order to be tested. Just my days are running together. I think it was yesterday afternoon, the CDC issued new guidance that's going to help us do more tests. As I've said to folks before, you can get up to 3 specimens in a patient, a nasal pharyngeal, an oral pharyngeal, and a sputum. They made a rule yesterday that you can do 2 specimens in 1 vial. So instead of having separate specimens, which would then shrink the amount of tests we could do, they're putting both oral and nasal into 1 vial, and therefore we can test more people. We originally had enough to test between 300 and 400 in our public lab, and we've saved those for the most sick, the hospitalized, people that are part of our investigations. And then some of the private labs are up and running and taking tests. They take a little longer than ours do. We can turn around within the day, and so that's very important that we get that information. The more information we get, which we'll be sharing with you very transparently on our website every day, so you could see, the more we know, the more we'll get a sense of where this is happening and how it is spreading. The third part of that is we're doing sentinel surveillance, which means that we're looking at clusters, high-risk areas. For instance, if we have a nursing home where we see a spike of influenza-like illness, but they're testing negative for flu, it's a respiratory disease, so we might think to go in there and do something. And we're working closely. I just spoke with my CDC colleagues. We're one of a few states that are going to be doing sentinel surveillance on behalf of the CDC. So, we're getting our hands around the scope of Ohioans, but as you know, travelers, everything that's going on in the United States, I think it's safe to assume, that we have community spread here.
Doctor, can you give us an update?
Tipping point for, when you might say that NCAA, no spectators at March Madness. I mean, is it going to take that there's, 20 cases confirmed?
Look, we've already recommended that this event not occur. And that's not, something a governor does lightly. And so one would hope that with Ohio's position that NCAA would go back and take a look at this. Now, I understand that they issued something today, but look, this is evolving. We have the safety of not only the spectators, but as Dr. Acton has pointed out, it is all the people the spectators come in contact with afterwards. So this is something that it directly impacts the safety of the people of the state of Ohio. And so we would hope that anyone who has the responsibility for conducting these events would make the right decision. We'll cross the next bridge when we get to it.
Governor, could I add?
No. I said before that it certainly can have the events. And what we're doing, the same recommendation, same thing as we did with the Arnold. Have the events, have the players. In case of high school, let the parents come watch. I just can't imagine being a parent and your son's team or your daughter's team is in state finals or something, you can't be there. I mean, we have to be reasonable about this, and we have to take that into consideration. But we can't have a lot of people there, and that's what the problem is.
Doctor, is there any talk of having state employees work from home?
Yes, we've asked our team and our cabinet directors to start drilling down on that and seeing which ones could actually work from home and which ones could not. Now, look, the obvious DYS and our prisons, you can't work from home. They can't remote. So, some of the state employees, our BCI agents, most of them, they can't work from home. So, a lot of things that are essential to the protection of the people of the state, people can't work from home. But there are some jobs, undoubtedly, in state government where people could actually work remotely, and we're asking every department to take a look at that. Look, what the state needs to do, everything that we're recommending in the private sector, the state needs to be doing as well. And let me just say, speaking of the private sector, I want to congratulate the companies that have been very proactive in this. And they have really done a great job. And this has cost them money, but they've been proactive in letting people work from home. They've been proactive in making all kinds of decisions. And I think what they understand, because they've got experts that is talking to them as well, what they understand is the better decisions we make now, the faster we get through this, and fewer people die, and less impact, less long-term impact on the economy of the state. The economy is not the most important thing. People's lives are the most important thing. But it's also true that if we can get through this, and move forward, the economy is going to be moving in the right direction after we're through it. The faster we can get through it, the better off we are.
Have you talked to the Greater Columbus Convention Center about
No,
conventions that are coming?
I'm not. Look, there's only so many hours in a day, and we're trying to do this as quickly as we can. We spent all morning and all day talking to as many different groups as we could, from one conference call to the other. No, we've not.
Cleveland political rallies,
Go ahead.
Cleveland political rallies, we've got two about it in an area.
Look, this is a First Amendment issue. Again, as I said yesterday, we can only give the advice. We can only say that the experts tell us that crowds are not good. This is something the candidates are going to have to decide for themselves. I'm not going to weigh in on the First Amendment issue, and they have every right to hold a political rally. Look, I'm saying that, I would not suggest someone go to where there's a large crowd. Whatever the purpose of that is.
Dr. Acker, you have a
Yeah, right back here in the way.
Your chart there, is there a time spectrum on that at all as we go towards spring? Is it something that people need to be thinking about? We're talking about recreation.
It's not a projection.
Festivals and stuff. Is there
Look, this is not a projection. It is, you can tell them what it is, but
There was a second chart. I don't think we brought it out. That's why I was pulling on it. But, we don't know. It's variable, but you can see sort of get a sense of what's happening by watching it move through the other countries. So we cannot predict. Every country will be different. Where the hot spots will be different. We're seeing what they are in our country right now, but that evolves. Quite honestly, in a day, you can see everything change. And so,
But Amy,
but that's the progression.
But that is a typical.
Yeah, that curve will happen. And there's actually 6 stages. And we have I think we have these graphs up on our website. If not, I'll make sure they're on there. But there's actually 6 stages. And with those 6 stages, I'm sorry, I'm not talking into this. With the 6 stages, you have different interventions. And if you really look at classic epidemiology, you'll see how the different, you're seeing a spectrum of options. And what the governor is really saying to everyone is, make the choices now to lean in a little harder. You have to keep leaning in. By the end of this week, it will seem like a different world than it is today. And that's the pace at which this change is occurring. And I think it's just really important for all of us, though, to recognize the reality of the situation. Our lives are going to be disrupted. And we'll get to the other side of it.
If you know, how many ICU beds and respirators do we have in Ohio, and to what extent do they appear to be adequate if you had something like a fairly widespread?
Take the first part.
Oh, please.
I'll let Dr. Acton answer that, but one of the things that we have done has been, in contact with the Hospital Association. We've had phone calls, we've had in-person meetings. So hospitals are very, very, obviously, an essential part of the preparedness for this crisis.
Yeah, and I'd say that, to see hospital whole systems working together is actually, they first reached out to me to ask about how they can do more even beyond a regional capacity. We know we have the shortage of PPE. One of the most difficult things, what our societies are trying to do in the end with this is not overburden our healthcare system. We need our emergency rooms, those ventilators, those ECMO machines, to be for the sickest. And so the measures we're taking now are actually making sure that our hospitals have every bit of bandwidth, every bit to deal with this. And really, that's one of the most important strategies that we're doing. I've been talking to Cleveland Clinic, Ohio State, others. They're doing things now like you asked the testing question, drive-through testing, curbside testing. You're going to see waivers from Medicaid that allow them to set up outside tents so people cannot go in the emergency room but be kept separate. Hospitals are talking about things like moving patients so they have whole wards to deal with coronavirus, therefore minimizing, most importantly, the impact on their own workers. And that's the thing, this logarithmic exponential piece of this that I'm saying is so important. You saw in Washington State again, where firefighters and first responders went into the nursing home, and the next thing they knew, they had 15 firefighters in quarantine. Now you don't have a fire department in a small town. And this is the ripple effect of the decisions we make. And therefore, only 1 or 2 people are going in a room, or people are gowning up in the full PPE, the equipment they wear to be protected, and only staying in it and seeing people. You're going to see some MASH-like creative solutions being made at a time like this. That's to be expected. They plan for this. They plan for every eventuality, and each thing will be just a little bit unique. But the basic sense of how they go through these stages, Ohio State has, for example, all sorts of things that they've been going through, drills and tabletops and new scenarios that they're moving their staff through as we speak.
So why is the difference in recommendations for?
Wait a minute. I'll go. What's the question?
I don't myself, I've seen that there are those statistics, and I think the Ohio Hospital Association has a sense of that collectively for the whole.
Why the difference in recommendations for colleges, sporting events, and K through 12? K through 12 seems like the same situation. You got a lot of people in one close contained space.
Yeah. This is again, these decisions may change as we move forward. The younger individuals, I'm told, are less at risk. I mean, there's older you get, the much more risk of mortality there is. You also have other ramifications. One ramification is in regard to healthcare workers who might not be able to go to work. That's a consideration. I'll ask Amy what else is the expert on this. But this is what we have simply said is they need to start thinking about it. They need to have a plan. We're not there yet.
Yeah, and I can tell you they're more than thinking about it at this point. You know, every school is looking at their online options. Schools deal with infectious diseases all the time, from measles outbreaks to the fact that some schools in Ohio have closed with regular flu season. So they're used to looking through these scenarios. I know schools are looking at changes to their meal policies to make sure, you know, cleanliness is everywhere. I mean, they're going through every single step of their plans, because schools plan for this much the same way, everything we've done at the EOC. So yes, it is true that younger people, the Surgeon General just said yesterday in a call I was on, that younger people might be a little bit less at risk. The risk goes from, at least our initial studies, the science is evolving. With the age groups, it just works its way on up. And there's not, when I talked to Ann Schuckett about a week and a half, 2 ago, she was saying we're not seeing the reservoir in schools that we've seen in other illnesses. But again, that knowledge will change. But an interesting statistic I learned today, 1/3 of nurses have like young school age students. So schools, things about school lunches, all of that is sort of, will be one of the later decisions that you make, although an individual community might have to make it sooner.
Governor, do you have a message to leaders who are using this virus to spread anti-Chinese American sentiment?
Do I have a message to, well, I would say that this is not a time, and I'm not directing this at anyone, I'm just in general, this is a time for us to come together. This is a time for us, for the goodness of everyone to come out. I mean, we have a common problem. No matter what your income, no matter what your age, no matter where you live, we have a problem, and it's a common problem. And so we shouldn't do anything that divides us. We should do things that pull us together. In my experience of the people of the state of Ohio, has been there is adversity, a flood, a tornado, a fire, the communities come together, and I think that's what you're going to see. And so we're all in this together, no matter whether our ethnic background, whatever our religion, whatever, we're all in this together. And so we got to act like we're in this together and pull together. And I fully expect, from what I've seen throughout my lifetime and my professional career, that Ohioans will rally and will do the right things.
And as I've said all along, viruses do not discriminate. They love us all equally. So we are all equally at risk and all equally need to help each other. I want to say that I've reached out to philanthropy, to the groups where I came from philanthropy prior to this job, and you'll see, I know today in Columbus, I know Columbus Foundation is launching a whole campaign, a Gifts of Kindness, and different campaigns just for this. We really need our nonprofits and our philanthropies, because we do know there are vulnerable groups that will be more affected by this. There are folks who might not be able to isolate or quarantine at home, and so we'll be needing some housing options, and we'll really be calling to all segments, as you mentioned, our religious organizations, but also our nonprofits and philanthropy are stepping up to the table. And then there is, as I've said all along, what we do for our neighbor, the elderly neighbor who might be alone and not have family, and what we can do. And so, again, this is a daunting, once in my lifetime experience. I guess I was around, I don't remember as much in the 60s of smallpox, but this is one thing we'll all be going through together. These will be stories we tell someday on the other side of it. We will get through it, but the disruptions to society are the impacts. And so thank you so much to the businesses and everyone else who are going so far out of their way to make this easier on their employees.
How's the patient in Cleveland who's hospitalized? Do you have a condition update on that one?
I do not. And I would say local health departments are on the front lines of this. For the most accurate information of what's going on in Cuyahoga, do reach out to Terry Allen. He's just a veteran health commissioner. They are on this. The hospitals are on it. And while they won't give away private information, if you want to learn more about the response there and the investigation, do ask Terry.
Any indication if she's improving, or unfortunately not?
That's not been shared with me.
Governor, do you foresee canceling the St. Patrick's Day parade in Cleveland?
Well, I don't have the authority to cancel the St. Patrick's Day parade in Cleveland. The recommendation is we not have parades.
Governor, is there any update on the possibility of a paid sick leave fund, a temporary paid sick leave fund, help some of these people who maybe can't afford to lose a paycheck and then stay home like the recommendations say?
Yeah, look, I don't have any recommendations on that.
Governor, do you have any suggestions for some of the colleges and universities in areas where like internet connections aren't that great? Are they able
Look,
to do remote learning?
Look, each college is going to have to make its own decision. One of the reasons I wanted to talk directly to the presidents, and I'm sure we didn't have every president on the phone, but we had a lot of them on the phone, is just to kind of tell them how we came to this recommendation and explain that. And, they're going to have to take that information and make decisions. I mean, one of the things you're starting to see nationally, is some schools literally close. That was not our recommendation today. It would not be I wouldn't say it was the wrong thing to do, but, at the bare minimum, go to, if possible, somehow go to remote learning. I mean, one of the things that I know Randy Gardner, the chancellor, talked about on the conference calls, and he has the information, I don't, but was the different ways, pretty low-tech ways in which it would be permitted for the professor, the teacher, to work with the student. So it's not all high tech, it's not all necessarily internet. There's other ways of doing it. Now, we're not saying it's perfect, and we're not saying they can do that completely. I mean, I talked to Ohio State's president today. I talked to the president, Dr. Drake, and I asked him what percentage of students he thought, or classes he thought, were able to be covered this way. And I can't remember the exact number he gave me, but it was a pretty high number that he thought. We understand that would be different, could be different in smaller schools, particularly in schools, as you say, or in more remote areas.
Is there any outreach for the homeless population as a result of this? Do you need to address that?
Yeah, addressing the needs of the homeless population. There are also communities where, I'm thinking the Nepalese community, for instance, where it's much more common to share a bedroom, and part of quarantine and isolation is you need to be alone in a room. So there are going to be interesting caveats to this. It's part of the planning that's done, but in the individual community where it occurs, that will be where in one community like Columbus, they might be looking, to a given nonprofit or another based on the needs. And then again, we might have to do something unique, like we saw in Washington. There are things like RV parks and mobile homes and hotels being used. So I think each community, based on the assets that they have at their disposal, and remember, the local health departments, when they do these plans for pandemic, all those partners have been at the table all along talking about, well, here's what I could do in this situation. And so it will look very different depending on the community. And we will see more and more resources over time come to us. But philanthropy is really coming up, in the stopgap when there might be a need this week, and I can't wait for the bureaucracy wheels to turn. And that's why it really will take all sectors of our society to work together. But we know how to do this.
Okay.
Dr. Axel, what is the significance of the sentinel surveillance that you mentioned? And is that, did I hear you correctly, that only a few states are doing that?
Yeah, the CDC, and you'll see more and more do it in more ways, but there's a special study that we're taking part in that Jose Montero from the CDC had reached out to me to see if we would do, and I'm like, absolutely, we want to be a part of that. And so what it is Sentinel is trying to see, I'm trying to get my hands around the extent of community spread. And very early in a pandemic or an infection like this, it's very hard to get all the data. We'll know much more with each and every day. But there are clusters of things that look suspicious. I've talked about the influenza-like illnesses where nobody's getting tested and I don't have a case, but something looks a little bit suspicious. And then you saw early on in this, the CDC had picked 5 cities to take the specimens from flu testing and just take those same specimens and test them for coronavirus, for COVID, for the virus, the SARS-CoV-2, because the virus has a different name. And so that's a way of them trying to see, this person might not even be symptomatic, because we're trying to get our hands around asymptomatic. But it's a way of seeing just in the general population, is this out there? Eventually, this disease will be amongst us in the population. Eventually, it might be something that is seasonal and that we test for as part of routine viral panels in years to come. And hopefully, of course, we'll have a vaccine for it to prevent it.
Thank you all very much. Lisa, you have a question, Lisa? No. Okay.
I do.
Last question.
Since you're being forward-thinking, have you discussed a population infection ratio that would make this more of a state emergency, assuming you have some kind of authority to do that, as opposed to recommendations? And if you have discussed that, what might that be? Rate of infection?
Not quite sure I understand the question.
Yeah, I believe he's asking about the R0 factor, and it's about the infectivity, and those numbers are varying widely right now. As I said, this is again not complicated, but I want to try to explain something to you. I've talked about Italy a lot. Italy, again, 2 weeks ago, 9 cases. What were they, over 9,000 today? It's hard to keep up with all the numbers changing. But the thing is, there's the time a person gets infected. They don't even know they have the disease. It might be up to 14 days. We're seeing quite often around the 5 to 6. Then there's the course of illness. People tend to start out, again, most people will ride this out at home, maybe be a little more sick than the flu, maybe be a little less. but they'll do fine and they'll recover. You know, we talk about the vulnerable populations, but from that time of someone first being infected, it might be 9 to 12 days before someone is hospitalized. And the deaths from this are trailing behind at 3 to 6 weeks. So what is happening right now in Italy, we won't know about. You know, people are just being hospitalized. So the data we're getting is sort of lagging behind, and that's why these measures we take now, every single step we take to do blue and not yellow, will make all the difference.
Governor, can you just, we're getting a lot of questions on our website about, again, the spectators going to sporting events. You are, at this point, are only recommending that they not go. You're not, this is not
Strongly recommending.
involving concerts as well. Sporting events, large.
Any gathering of people of any size indoors. Thank you all very much.
Are these break-ins going to be every day at this time, or do we have an